Hi, this is Dr. Hizon, here to talk about documenting for a patient with a knee injury. As a general disclaimer, please refer to your particular doctor, as this is a general course not intended to be medical treatment, and your particular situation may vary. So the symptoms are very common to have knee injury and from trauma or gradual. The pain is with weight-bearing activities, it could be with exercise or trauma, and the patient may complain of popping or grinding. The physical exam, there's tenderness to flexion and extension. Flexion is if you bend the knee, extension is if you straighten it out. And they may have different kinds of positive, provocative tests. Apley, McMurray's, tenderness to varus or valgus stress, anterior-posterior drawer, Lachman test, an anterior or posterior Lachman's, and Ober's test. So there's testing, and the workup is usually history, physical, x-rays, sometimes musculoskeletal ultrasound, and even MRI. The treatment is to avoid activities that irritate. Commonly, it's very common to use anti-inflammatory medicines, exercise either home or formal exercises, and a lot of times ice. You can do injections. There's different kinds, cortisone, and even orthobiologic ones like platelet-rich plasma. And then there's surgeries, both arthroscopic, done through very small incisions, versus open procedures. Patient education is usually to avoid aggravating activities. You can ice it, you can elevate it, you can use different kinds of pain relieving techniques. There's stretching and there's strengthening exercises. So on documenting for the patient with a knee problem, you want to document a typical chief complaint might be the pain is it the left or the right? Remember, it's very important to get the laterality right. In the left or right knee, times say 7 weeks. So Mr. Jones is a 55-year-old male with a history of, like, say, depression or something, presents today for pain to the left knee for 22 days. And we talk about the date of onset and your typical questions about sudden or gradual, where's the location, does it hurt in the front or the back or the side, and how is the pain level on a severity of 0 out of 10, where 10 is the most pain you've ever had in your life. What's the pain at rest? What's the pain with activity? Is it constant or intermittent? Is it sharp, dull, or achy? And then provocation, like what makes it worse? And then also alleviation, what makes it better? And what other symptoms are associated with it? So you can step through the template. Especially it's important to note what previous treatments have been done so far. Rest, injections, medication, physical therapy. Has there been any imaging, x-ray, MRI, magnetic resonance, ultrasound, and what other specialists has the patient already seen? Orthopedic surgery, chiropractic, massage, or acupuncture. And then on a review system, the past medical family social history, do they use tobaccos, has their exercise, nutrition, sleep program, and constitutional symptoms like weight loss. Have they lost or gained any weight since the last visit? And then step through all the different aspects of the review of systems. On the objective, give a general overview, talk about cardiopulmonary and abdominal examination, and then you want to look at the joint above and below. So for the knee, you look at the hip and you look at the ankle, and then you look at the unaffected side and then the affected side. And typical things that we'll look at for the affected knee is how's their gait, are they guarding, do they have deformity, is there any swelling or effusion, poor alignment, edema, erythema, which is redness, ecchymosis, which is bruising. And on palpation, is there tenderness to palpation? Is it in the bones, ligaments, or tendons? How is their active range of motion, their passive range of motion, their resisted range of motion? How are their reflexes, sensation, capillary refill, neurovascularly intact? And then there's special tests such as the Lachman, the anterior or posterior drawers, Solcombe's, varus or valgus laxity or tenderness, McMurray's, Apley's, Noble, and Ober test. So on the assessment of the patient with knee injury, is it a simple or complicated case? Does it require straightforward or complex decision making? And this is a time where the provider can give their rationale and reasoning for why they came up with their diagnosis and their treatment. On the diagnosis, ICD-10 codes, typically these are M codes. So pain to the right knee would be M25.561, left knee is M25.562, and then you can also talk about chondromalacia or bad cartilage to the right knee or the left knee, and there's many other ones like this. However, always understand if it's an orthopedic injury, you do want to put down the activity you were doing, say basketball, which would Y 93.67, or other, so the activity, and then where was the place that this injury occurred, and this would be a Y 92.39 if it was, say, on a basketball court. The plan and treatment, usually it's home exercise and or formal exercises, and inflammatories, imaging, and then possibly injection and or surgery. So on the pearls and pitfalls of documenting for the patient with a knee injury, be sure to get the correct affected side, and this is the patient's left or right. Be sure to document all previous treatments, surgeries, previous injuries, and be sure to learn the various physical exam tests such as the Apley Grind, McMurray's, Valgus, or Veris. Ask your doctor if you have any questions about the actual documentation for the physical exam, and in primary care, remember to ask about quality measures. Takeaway points: injuries to the knee is very common. It's very, very important to get the laterality correct. Usually there is traumatic mechanism, so you want to get that down. And you want to always document the unaffected side as well as the joint above and below the injured joint. So study hard to learn the various knee tests that are commonly used as shortcuts for the knee exam, such as the McMurray's, Veris or Valgus stress, and Lockman test. And in summary, we appreciate all that you do, because while doctors save lives, medical informatics specialists and scribes save doctors. Thank you.